Most people, they've heard of genetic immune disorders, but secondary immune deficiency is actually way more common.
And it's not a defect in the blueprints, it's a defect in the maintenance, or like something that has occurred later on in life that is damaging your defensive wall against like the world around you. How come, I never had anything in my life, and all of a sudden this year and last year I had pneumonias 2 times, and I had to take antibiotic, and the antibiotic I was taking orally was not working. I had to go to the emergency department.
This is the Transformational Life Consulting Podcast with Deepa, Grandon, MD, where Christians like you get the practical support and tools you need to build your spiritual, mental, and physical well-being, and to guide you on your journey to health and wholeness based on evidence-based science and God's Word. I am your host, Dr. Deepa Grandon. Welcome back to Time to Transform, the podcast where we explore the science and practical strategies that empower you to live healthier, longer, and more vibrant lives. So, to our returning community, welcome back. It's always such a privilege to share this journey of growth and transformation with you. And if you're joining us for the first time, we are so glad you're here. So as most of you know, Time to Transform, our mission here is very simple, just to bring you conversations that are both deeply meaningful and immediately actionable, insights you can begin applying to your life today, because we know that true health isn't built on just a single habit, right? It comes from intentionally caring for every aspect of who you are, your spiritual, mental, emotional, and physical well-being. So lasting transformation, it really happens one choice, one habit, one day at a time. So today's topic is one that affects millions of people around the world, yet most have no idea it's happening inside their own bodies. And we're talking about secondary immune deficiency. So what does that mean? So it means a person's immune system becomes weak over time, not because they were born with a genetic disorder, but because of other external factors. It could be an illness, medication, poor nutrition, even obesity, which I'm sure some of you might be surprised to find out, environmental exposures, some other lifestyle influences. So in my own practice, this is something I encounter regularly. I see patients who have spent months or even years keep having recurring infections, chronic inflammation, persistent fatigue, and very slow to recover from illness. And they've all, usually seen several specialists before they end up in my clinic, and they've undergone countless tests. They've tried numerous treatments, yet one fundamental question is frequently overlooked, and that is the immune system functioning the way it should? Okay, so many people associate immune deficiency with some rare inherited disorder diagnosed in childhood. So these conditions are definitely very important, but the truth is they're relatively uncommon, while secondary immune deficiency is actually way more prevalent, and it's often something that happens silently over time. And especially fascinating is how many modern health challenges intersect with our immune function, For instance, nutrition, it profoundly influences our immunity. Micronutrients such as vitamin D, zinc, they play a very important role in our immune defense. And, like I brought up before, obesity creates like this chronic inflammatory state. It really changes how your immune system functions. And nowadays, we know that GLP-1s are widely prescribed to treat diabetes and obesity. And it also seems to influence the immune pathway. And we're still trying to understand the whole depth of how GLP-1s influence the immune system. So these are very complex topics, and there's a lot of misinformation surrounding them. And the science is continuing to evolve, making it even more important than ever that we steer clear from speculation and take a clear, deep look at the evidence. Okay, so to help us to do exactly that, I am so happy to welcome an old colleague and a great friend of mine who's also internationally respected expert in allergy and clinical immunology. It's Dr. Fulvio Salvo. He has trained and practiced at leading medical institutions around the world, including San Rafael Hospital in Italy, Cleveland Clinic Abu Dhabi, and he now serves as a clinical immunologist and allergist in Cairns, Australia. And throughout his career, he has cared for patients with complex immune disorders while gaining a very unique global perspective on how genetics, environment, nutrition, lifestyle, modern medicine, all of these influence our immune health. So today we'll discuss what secondary immune deficiency really is, how to recognize it, and the surprising ways nutrition and lifestyle shape our immune system. What are clinicians learning about medications like GLP-1 receptor agonists, and what every listener can do to support a healthier immune system. Dr. Salvo, welcome to Time to Transform. It's truly an honor for us to have you. Before we dive into today's topic, I'd love for our listeners to get to know you a little bit better. So can you tell us what inspired you to become an allergist, immunologist, and what has kept your passion in this field, just,
Yes.
throughout your career?
Yes, thank you. Thank you, Deepa, so much for your invitation. You know how much I enjoy this little conversation we have once in a while. And that's a very good point why I choose to become an allergist and clinical immunologist. As you may know, and as you said already, we do see a lot of strange and interesting diseases in our practices. And that's basically what struck me at the very beginning, the fact that it was a field where a lot of the a lot of the patients we were seeing were classified as idiopathic. The cause was unknown. So there was a lot of things to discover and unpack. And that was the single thing that basically interested me the most at the very beginning, the fact that there was still a lot to discover and to develop. So that's what basically at the very beginning drove me into the field. Then the fact that I had great mentors and I could learn from them was also a very important factor. And I enjoyed my practice all over the year and all over the places I had the luck to work in. So I can see now that our field has evolved a lot, and secondary immunodeficiency is the best example probably of something that was badly overlooked in the past, and now it's a point of discussion for most of our patients. Now it's so much more interesting. So the fact that things start to come under the spotlight, so there is even more things to do.
Yeah, very true. Sometimes we don't always think about it, but the more we read and understand, the better we can identify when we see these patients. And from your perspective, because you've had the unique opportunity to practice in different parts of the world, you're currently in Cairns, Australia. And so when you look back over your career, have you noticed changes in people's immune health? How do you see our modern lifestyle, right? Like we don't spend as much time outdoors, eat a ton of processed foods. There's so much obesity in our society, environmental pollution, chronic stress. How is that changing the way our immune system functions?
Yeah, that's a very, very interesting factor, Deepa. And just thinking like the places I've been practicing and how population usually approaches their life. Like you start from cities in North Italy, so large city, people are busy. They spend most of the time like in offices, inside, and stress is there, lack of sleep, all things that might be very, very important. But still, like everyone knows in Italy, maybe diet is a little bit better than many other parts of the world. So you have a sort of compensation. In the UAE, as you know very well, despite being a very sunny country, people spend most of their time indoor because of the climate, and this is a strong has a strong impact on their immune health and in their normal lifestyle, because people tends to be maybe less active outdoor. They have a significant lack of sun exposure, which, as we maybe will discuss later, might have important repercussion on someone's health. And nowadays, I'm in tropical far north Queensland in a regional setting. So here, as I'm right now, I'm outdoor, and so people tend to spend quite some time outside. But still, there is a very important need, for example, for sunlight protection because of the rate of other diseases such as melanoma. So significant use of sun screen is recommended. So people still, they are outdoor, but in a different way as we used to be. So the lifestyle is different. There is a lot of physical activity. So all these small things may impact how the population in each specific part of the world take care of their body and of their health and their immune health as well. And as you were saying, nowadays we're seeing a lot of new factors coming into the picture, new medication, new suggestion. There is a lot of attention, correct attention on the things that we eat, understanding that something that we introduce like 3 times a day for all our life may be more important than taking a supplements for a course of 1 month. So it's a very, very unique time right now, I think, to act and to start doing something to help our body.
Yeah, I think those are really great points. You must be seeing very different pathology where you are now in Australia compared to the UAE because of the
Definitely
races. So that's actually good. So I think you were before this podcast, you were telling me how you're doing these ultra marathons and everything. It's amazing.
Yeah.
Yeah. How
life in Australia is has a lot of different aspects compared to the one that we used to have, when we were working together in the UAE. Definitely there is a lot of attention for your body and your fitness status. My colleagues are all super fit, so I enjoy going with them, cycling and running as well. It's basically a virtuous process of enhancing each other, taking care of your body in a way that, so it's always, you're always on time to pick up new good habits in your life. So
yeah, that's nice. So you have a community that believes the same things like you. So that's great. Yeah. So, most people, they've heard of genetic immune disorders, but secondary immune deficiency is actually way more common. And it is an acquired impairment in immune function, and, medications, malnutrition, I think, is the most common worldwide. We don't see it as much in the developing or developed nations, but it's definitely the number one cause in other parts of the world. Chronic infections, malignancies, metabolic disorders. For us here in the US, the American Academy of Allergy, Asthma, and Immunology, they've actually published this practical guidance, and it emphasizes that clinicians should really maintain this high index of suspicion when we have patients with these recurring infections, abnormal immune evaluation. But in spite of all of that, it seems like secondary immune deficiency stays largely underdiagnosed. So can you explain what secondary immune deficiency is? How is it different than primary immune deficiency? And why are so many people going undiagnosed?
Yeah, that's a lot of information, Deepa. Let's unpack some of this together. So when I explain to my patient what is a secondary immune deficiency, I like to compare to the other group of diseases that you mentioned before. So the primary immune deficiency, those are the one that basically everyone has in mind probably when they think about immune deficiency, which are a large group of sometimes super rare, super complex disease, genetically determined, that might be diagnosed most of the time in early childhood, some of them with very dramatic manifestations. So those are the ones that usually are more easier to remember because they have a very significant impact on small patients' lives. But actually, just imagine that as a defect in the blueprint that basically creates your defenses against the microbes and the environment, right? But actually, as you were saying, much more common is not a defect in the blueprints, is a defect in the maintenance, or something that has occurred later on in life that is damaging your defensive wall against the world around you and microbes as well. So secondary immunodeficiency are this large group of sometimes very diverse issues that may arise during your lifetime due to conditions that were not present when you were born, such as, for example, you were saying nutrition. And you're right, that's definitely the most common cause in the world, because there are large areas of the world where food is most of the time not sufficient to guarantee a healthy immune system. So the nutritional deficiency maybe arise because of the lack of nutrients in the diet, but may also arise for states, metabolic states or disease states that affect your gut. So the way your intestine can absorb, your body can absorb the nutrients from the food, or the fact that, for example, you are losing some of the nutrients of the components that are required for a healthy immune system through your gut because you have a chronic disease affecting your intestine. So the way our body can take the nutrients from the food is definitely the most common one, but that's not the only one. There are very easy example diseases. HIV, most common form of infectious immunodeficiency. Maybe nowadays there is less attention in that, but still a significant cause of morbidity around the world. Or, for example, medication. So now we have incredibly powerful drugs to control diseases of the immune system, or, for example, cancer. These are able to fantastically improve the survival of our cancer patient, but to do so, frequently they affect deeply their body and their immunity, and they can create state of immunodeficiency that go well beyond the duration of the treatment. So that's another important factor. And you were saying then a lot of miscellaneous. So add many other causes that can affect how your immunity works. That depends on your lifestyle. For example, regular exercise, exposure to the sunlight, or, for example, the way you sleep, which is frequently overlooked. So sleep health is strikingly important in the way our body function and on the immune system as well. So it's very important to put all this information together when you are approaching someone with like an abnormal type or number of infection. Let's put it this, maybe we'll discuss this better later. And why they're so underdiagnosed. That's an interesting point. And I wish, if we have this podcast in 5-10 years of time, we would not be talking about underdiagnosis for this patient. But right now, or what used to be even more true in the past, is that frequently these diseases are overlooked. Clinicians themselves don't consider the possibility because they used to take care, or they take care even now, of their part of the picture, right? So you have sometimes this patient coming to you, they have been to multiple specialists and everyone did a great job in their specific expertise field, but no one was able to connect the dots together and see all these things are happening because there is a problem deep inside the body, right? It's not only a matter of nasal congestion or chronic sinusitis or recurrent sinusitis. It's not an issue of a lot of, for example, upper respiratory tract infection, or maybe I had a pneumonia or I have an abscess. It's not about the single problem. It's what is connecting all the dots and putting all these things together in my patient. So that extra step is frequently missed at the beginning and takes a little bit of time and efforts to be done to uncover something that is explaining actually what's going on in our patient. So I guess like even activities like this one we are doing, it's very important because it increases awareness in both professionals and the general public in understanding better what might going on in their body.
Yeah. And I think that even with obesity, right, we see so much of it in our society. And I think that COVID really highlighted something, especially for me when I was looking at some of the data. For instance, in China, the people who were dying predominantly from COVID were like 70s, 80s, like the older people. But here in the US, it was people in their 20s, 30s, the minorities, and these individuals had a lot of chronic lifestyle disease related issues, like obesity especially. They tend to die, which showed us so much about biological age, right? So people in the US, the younger population had bodies like the Chinese older individuals. So they had to show so much about the biological age because of their lifestyle choices, their poor nutritional intake. And unfortunately, we do see what's called food deserts here, where you don't have good, nutritious food options easily available to certain minority populations. Yeah. And so it's like really a thing we have to be paying attention to. And as providers, to also keep that at the back of our minds when we see these individuals, you know, with these chronic lifestyle related disease, because we know, for a matter of fact, diabetes for sure impacts immune response in a very bad way. And so, yeah, keeping that in mind, even with our obese patients. I mean, the good thing about the GLP-1s, as much as we still don't know a whole lot about it, the anti-inflammatory effects we see as these patients lose weight also highlights how inflammatory these fat cells are, because they're not just like fat sitting around. It's fat that's inflammatory and, you know, really number to the body.
Definitely. This is something that it's coming up as a major issue on multiple aspects. Like, you know, it's not only about infections. Here we are talking about a state of inflammation of the body that can influence a lot of different like aspect of someone's health. So basically, just to give like a quick a quick idea of what's going on in someone with a significant fat deposition. You know, these fat cells at the beginning, they are still healthy when they start to grow. And as far as they increase their size and like basically are stretched, this basically causes less oxygen, less nutrients to reach these areas of the body, right? So just imagine this huge fat deposition that are chronically hypoxic. So not enough oxygen, metabolic processes cannot really run well. And some of these cells dies, right? And when a cell dies in the body, is not an easy time. Like, you know, the cells dies and releases whatever is inside outside, and our body knows that that's not good. So it responds it responds in a way that basically creates, usually at the beginning, more inflammation. So you have macrophage, your innate immune system, that basically strikes there to try to confine the inflammation. But to do so, it basically creates more inflammation by recruiting more cells, by trying to increase the blood flow. So that's basically the toxic microenvironment, which in someone obese can be like a huge part of their body, right? And this influence not only the microenvironments, because what happened there then translate in many different areas of your body. So it can increase your cardiovascular risk, because whatever comes from these areas is then transferred to the blood circulation. So it seems like the effect that we are starting to uncover of the GLP-1 agonist is that not only the reduction in, like, you know, diabetes and the body weight, but they may act directly on the immunity, especially on the innate immune system, by reducing or skewing the response from, like, you know, an active inflammatory response. So your I don't know, your SWAT team that respond like very heavily, but with a lot of casualties around, into a more, anti-inflammatory or immunomodulating response, where the same cells, macrophage, usually starts to work in a different way by decreasing the inflammation, try to confine the damage there, and clean up the area. So it might be a dual effect, or a multiple effect. Let's put it this way. So not only weight reduction, better glycemic control, but also increased immune tolerance. So the fact that you are able to confine and reduce your inflammatory response to the same stress.
Yeah, very true. And something that, you had also mentioned. So we look at red flags or warning signs when we're talking about secondary immune deficiency things. At least as immunologists, we see patients who have these recurring cyanopulmonary infections, sometimes unexplained autoimmune issues.
So when I teach students on this, I always tell them, remember, there are red flags, but these are not diagnostic criteria. We like to think always about diagnostic criteria, right, to make our job easier. But in a secondary immunodeficiency, or immunodeficiency in general, because most of this information are basically taken from the primary immunodeficiency field, you have red flags. So you have criteria that should turn on your switch to think about this problem. And yes, you were saying exactly right. So it's not a single specific number, even if you can find a number there, but it's the pattern. It's what's going on compared to before. So yes, more than a certain numbers of sinus infection, or a number of infection that is unusually severe for that specific patient. So how come, I never had anything in my life, and all of a sudden this year and last year I had pneumonias 2 times, and I had to take antibiotic, and the antibiotic I was taking orally was not working. I had to go to the emergency department. They gave me IV antibiotics. So these things are it's the evolution over time, or the change in the pattern, that should raise the suspicion. So not everyone is the same. If you have you have sometimes patients who at the end are perfectly healthy, and they are concerned because they start having, maybe in a winter time they had 5 viral illnesses, right? And when you ask their history, they have a little one that's just started going to the kindergarten. So when kids enter the social life, we know they basically become little viral reservoir, right? So they bring home everything, and yeah, it might be perfectly normal that year you'll be sick a little bit more frequently, right? But if that's not the case, and this pattern persists over the year, is no more linked to a social exposure, then yes, even upper respiratory tract infection may become concerning for a state of immunodeficiency, right? So it's important to know criteria, because those criteria should prompt the evaluation of what's going on, not because you need to feel them to start thinking that something it's not right? So I always recommend my colleagues, keep your index of suspicion high, and always ask the history behind our patients. It's not only the single complaint they're coming with, but what's going on behind that.
And what type of testing would you recommend to begin that evaluation?
Yeah. So for most of these evaluation can really start at the general practitioner level. You don't need to wait to see an immunologist. We are very important specialists, but frequently we do represent a bottleneck in our patients' journey, because we are so few, right? So general practitioner, family physician can start an immune system evaluation, and usually it starts with quite simple tests, right? So when you see that patient with in which you are suspecting a state of immunodeficiency due to the presenting history or the background history of use, for example, of a medication, starting with simple things. So whole blood count, with differential gives you an idea of the like raw number of immune system cells, right? Or the presence of anemia, or the presence of, like, for example, chronic inflammation with an increased number of platelets. Having a screening of the immunoglobulin level that can be done like super simply just by testing IgG, if at the bare minimum, right? But like, it's not so difficult to like explore the three main classes of antibodies, IgG, IgM, IgA, which already give you a lot of information. You can start asking for example, HIV test, chronic presence of hepatitis, chronic hepatitis, or the response, or like a TB status can also be something that you can do as a general practitioner. Kidney function, thyroid function can be useful. You can ask, for example, for the glycemic status, so see if there is underlying pre-diabetes or anyway predisposition to have high blood sugar. You can test your kidney, your liver, and maybe a urine test to see if there is any evidence of losing protein through, for example, your urinary system. These are very common, easy tests. Probably most of us already done this, like, in our life. And it's a very good starting point also when the patient comes to our clinic as immunologist for the second round eventually of testing.
Yeah. And I also tell like our infectious diseases colleagues and our rheumatology colleagues, especially if they're starting the patient on a immunosuppressive drug, can you please do some baseline immune lab?
No, Deepa, you can't stress this enough. This is also in the quadruple AI guidelines. It's stressed very well. Like, draw a baseline starting point when you are introducing a medication that might affect, for example, the antibody production, the level of immunoglobulin, right? So, like real life stories, how many times, like, you see a patient with a previous history of treating a B-cell lymphoma who underwent the use of a medication that can affect the cell number, right? But we maybe discuss this a bit later, but the patient comes and with a history of chronic sinus infection, and you check your immunoglobulin, the immunoglobulin, they are low, and you don't have a baseline. So what's going on there? Is a secondary immunodeficiency, or it's a primary immunodeficiency that we know in some patient might increase the chance of having a lymphoid malignancy as well. So, and it's really, really difficult to find the real answer. Many times you basically don't know, and you just go with the treatment and make them feel better, but still you are not sure what was the real early cause. So yes, baseline, it's so important that it's good to stress for every physician who can start medication that might affect the immunity. So give us a lot of help later on.
Yeah, because not all patients, even like say rituximab, actually end up with immune deficiency. So it's really very important that, just make it a standard rule. Like everybody just does a baseline lab before they get put on medication.
Yeah.
Yes.
The problem now is that Deepa is very fragmented, the practice, right? Because we know that, for example, rheumatology guidelines might say something, while hematology guidelines might not say the same thing for the same medication. Yeah. So having a shared common point of view on this might help introducing this test as standard of practice. So every time you start an anti-CD20, which basically depletes B cells in the patient's body, you need to have a baseline immunoglobulin level. That's would be so easy. And because these patients already do a lot of tests, right? So just add one and maybe start monitoring that instead of waiting, to see clinical stuff coming on. It's not expensive. It can be done maybe once a year, and can tell you in advance the trajectory this patient is having. As you were saying, not everyone will develop like a hypogammaglobulinemia even using the same medication. So this is a very valuable information to get.
Very true. So if we could just go back to GLP-1. I know we briefly touched on it. It's just that I personally do see a lot of patients are already on it, Ozempic, Wegovy, and we know they're being prescribed more and more. So some of the evidence we see is they do suppress NF-kappa B, which are, some of these inflammatory signaling pathways. And one review actually raised concerns that the GLP-1 agonist can create like a tolerogenic environment, which means it can reduce vaccine responses. Although it's not been proven in more randomized controlled trials, they actually found it reduces serious infections, the GLP-1s, receptor agonists.
Yeah.
So, and that includes like respiratory infections, COVID-19. So the picture is quite nuanced. And we had spoken a little bit about the anti-inflammatory effect, and we know anti-inflammatory is not the same as immunosuppressive. But I think it's important clinicians and patients have to be aware that there's some amount of immune implication with these medications. And now we have millions of people taking it. We're learning more and more that, like you said, it's not just about blood sugar and weight reduction, but it's also its impact on the immune system. So what do we know, till date, about their effects on immunity? And should patients have any concerns?
So, as you were saying, this is like expanding field, and we are learning a lot of new information about this medication as long as we are using them. And when you start using a medication in such a large number of patients all at the same time, you can uncover effects that might not be so apparent when you use it in a small number of patients. So these effects were not obvious in trials that were designed to explore their efficacy as, for example, glucose reduction. But nowadays, yes, we are coming to see a lot of other effects. And the effect on the immunity, yes, you were saying, most likely it's a combination of factors. They might interfere. So we know that the same receptor is present in several tissue, like pancreas, the intestine, the stomach, but might be present, and there are actually reports saying it's present also in immune system cells. So they would definitely affect metabolic processes also there. And the evidence is still very, very preliminary. There are still not very strong data. And as always at this stage, you might have conflicting results at the very beginning about the effect, for example, as you were saying, on vaccination. But it's definitely an interesting signal, the fact that this might interfere or affect our body in a way that it's not so obvious when these medications are marketed. So we think we are taking something just to lose weight, but this is actually affecting several metabolic processes in our body, and might affect how our immune system responds to inflammation, as we were saying. And probably there are many factors working together and enhancing each other, as we were saying. It's true. It has been described that they are able to reduce the severity of some infection. The explanation behind that is not so obvious. So might that be because patients tend to lose weight? So we know that pneumonia in someone with a BMI of 48 and difficulty breathing and difficult ventilation or glycemic intolerance might be much more severe than the same pneumonia in someone who has already lost maybe 20% of their body mass, and they are the glycemic control is now much better. And so it's the effect on the immunity, or is the effect on the rest of the body? It's probably both, I would say. But more and more data will be generated in the next future. A lot of research groups are actually working on this. And right now, if I want to close this with a recommendation, there is definitely not enough data to say that you should not be or should skip vaccination because you won't have a good response. The recommendation are just go ahead, take whatever you have to take.
Yeah.
It's most likely effective anyway.
Yeah, for sure. Because even with the immune deficiency or immunosuppressive medications, I tell my patients, go ahead and take your vaccine.
Yes. That's true. That's true for most of them. Like you were saying, like some of the vaccines need to be used carefully in patients with immunodeficiency, but these are actually a minority right now. And that's another important point is like even before starting the medications, since we know they're going to affect the way your body responds to vaccine, can be very important to perform all the required vaccination before starting, because you're basically putting there in the bank basically some useful information for your body to fight future infection, and this might not work in the same way after you start that medication. So very important to vaccinate yourself before starting an immunosuppressant treatment.
Yeah, very true. So we know, and we both spoke about malnutrition being the most common cause worldwide. Specifically, we think about protein energy malnutrition because it impacts your cell-mediated immunity, which is a very specific type of immune cells. And we've had publications, the most recent one in 2025, which demonstrated that even after you refeed and restore body mass, the myelopoiesis, or the way the cells are being recreated, they remain dysregulated, and these individuals continue to stay susceptible to infection, meaning their immune damage from malnutrition may not be fully reversible. So my concern for my patients who live in these food deserts, where access to these nutrient-dense foods are limited. So we have communities that are facing these hidden epidemics of micronutrient deficiencies, which could be driving an immune dysfunction. So when we hear it often being said, good nutrition supports your immune system. But how strong is that science behind it? Can poor nutrition actually weaken your immune system? And if someone improves their diet, how completely do their immune system fully recover?
That's a lot of important points there, Deepa, and I think you frame it correctly when you say like correct nutritional deficiencies. Let's take it from the patient's perspective, because probably in your practice as well, many times you have like question is like, how can I help my immune system? How can I boost my immune system, right? And that question is it's tricky, because we know that there is not a magic potion to boost your immunity. If you are healthy and you don't have nutritional deficiency and you don't have low level of certain vitamins or of nutrients, there's not really a lot of evidence that like having super therapeutic doses of vitamins will really help in any way, right? So, but nowadays we know that deficiencies in several factors might affect very deeply the way our immunity responds to infections, and protects or also the way our body functions as well. So the nutritional deserts are so concerning because many times are like just there. Like we tend to consider malnutrition as a problem like related to, I don't know, wars, famine, and countries that are far away that we don't really have like to deal with. But that's absolutely not true, because, for example, obesity, it's a risk factor for having certain nutritional deficiency. So instead of the excessive calories is the quality of the food that you intake that affects how your body actually works. So you might have a lot of protein or a lot of sugar or carbohydrates, but you're not taking enough zinc, for example, or enough vitamin C. Like just to bring up an example, we had recently here a patient with a very strange presentation with a rash and underweight and blood effusion in one of the knee, and everyone was puzzled, like, what's going on? Like a normal person going to work, but going through a difficult time, so living alone, eating very badly. The patient had scurvy, like vitamin C level was undetectable, and this was the someone you might see like in a shop when you go and pay, like, right? So someone you would assume like has a normal diet and it's just you are doing. Yeah. But that's not true. So the desert is there, is next door. You just need to look for it. There are also a lot of, how can I say, misinformation, because everyone wants to take care of their body in their best possible way. So that leaves also a field open for a lot of, uh, let's say, mixed information about what you should do. And many people feel that taking a lot of supplements will actually benefit them. But most of the time, it depends. It depends on your starting point. And even the effect of these elements and vitamins might be different if you are starting from a depleted state or if you are already perfectly fine at baseline. Let's make an example, like classic few things. Vitamin D, for example. Vitamin D is probably one of the most important and well-known vitamin. And a lot of people are actually taking vitamin D, right? Because like osteoporosis prevention and calcium metabolism. But we know that vitamin D might have metabolic effect in so many different parts of our body that limiting its role just to calcium metabolism is probably very reductive. So it affects our immune system function, probably in a way that we still don't know completely. But yeah, there is a lot of active research on this. But we know also that our body, it's created, has evolved to function with a certain level of vitamin D that maybe not everyone knows, but we basically produce by exposing ourselves to the sunlight, right? But just imagine, like, evolutionary speaking, our body was made to stay outdoor and spend a lot of time under the sunlight. So that's the correct exposure to get the healthy level of vitamin D. But basically, almost no one does that in the modern world. So we spend time inside. When we go outside, we are covered with sunscreen, which is great to prevent melanoma, but it also filters the UV light that are used to produce vitamin D. So we probably stay in a chronic state of deficiency of vitamin D that might be minor in some patients, but may be very severe in other patients. And yes, working on that can definitely affect the way your immune system responds to that. Said so, the evidence of this, it's usually a mixed bag because it's so difficult to generate sound quality data on this field that, like, many times when like groups attempted to generate, like, meta-analysis, so grouping goes together all the studies, they faced such a diverse field. So all the data are so different, the dose, the route of administration, the baseline. Many studies didn't even measure the baseline level of vitamin D. So it's very, very difficult to clarify what's the effect of like a certain dose of supplementation. What I can tell you is that, like, if you want to do something, just, consider your lifestyle. Sometimes measure the level. There are societies who even say, like, you don't even need to measure. But yeah, I think like that's still a reasonable thing to do. If you are depleted, target to have a normal and recommended vitamin D level by taking supplements. And we know that daily or weekly administration are better than, like, the very high dose given like every 3 or 4 months. So that's something easy, will help you on many different ways, and very unlikely to produce any kind of harm, because like vitamin D, before you enter into a toxicity field, you need to go very, very high. So that's an easy thing to do. And vitamin D is a perfect example of that, because even if we do produce it, like most of the time we are severely deficient on that. If I can take like another 2 minutes, another important thing that I used to say to patients was zinc. It's an element that helps our immunity, like, work normally. And we know very well that those patients who are zinc deficient and who are this deficiency is corrected, they are able to, like, respond much better. The immune system can work much more efficiently. But the same thing is not true if you already start from a normal baseline. So if your zinc levels are normal, there is not really evidence that providing extra zinc will make your immunity better or able to fight or protect you or prevent infection. But there is a but. It's actually very interesting, the effect of zinc lozenges. on the rhinovirus infection, so the common cold. So it has been shown that if you use zinc lozenges in your mouth, so by this oral dispersible formulation, they are able to reduce the duration of a common cold of like a significant amount of days, like up to 3 days. And that has been shown in many studies. So it's likely to be confirmed and absolutely true. So that's an easy thing to do, very, let's say, natural and very acceptable for many patients that you can do when you have like a common cold and you want to help your body fighting the infection. So that's your intervention. Zinc lozenges to have they probably have a direct antiviral effect. So that's usually what I suggest to patients.
Yeah, that's great. That's great information. That also, really, I find fascinating how the route of administration really changes indication and what exactly you're trying to help the patient with. And going back to your point about vitamin D obtained through direct sunlight versus supplements, we now know they're not the same. The vitamin D that's created through sunlight, the multiple health benefits, we don't see it replicated with supplements. Some of the things like the nitric oxide production in the skin, anti-cancer effects. I mean, some of those with the sunlight, it's really fascinating. And I also like how you're talking about the zinc, the oral mucosa, the way that absorbs it is quite different than just swallowing a zinc supplement. So that's really cool.
Yeah.
So go ahead.
No, I was saying vitamin D, it's such an important topic right now. And we know that, for example, it like the sunlight can change a lot the way you produce that, depending also on the part of the world where we are actually living. So we know, like in the US, if you are in Boston or in Chicago, that's different than if you live in Florida because of the angle the sunlight that reaches your body. So when you have like sun exposure, even if you spend a lot of hours during winter time, but the sun is actually not very high on the horizon, the atmosphere will filter most of the UV light, so you don't get like the same production that if you expose yourself the same amount of time in a southern area of the US, for example. So that's an important thing to know.
Yeah. So thanks, Fulvio. For the sake of time, you've shared amazing amount of information with us. But before we conclude, can you just share 3 things everyone can do today? So if you could leave our listeners with just 3 practical things that they can start doing today to build a healthier immune system, what would that be?
Okay. Let's put it in this way. I will use in the first bucket, I will put lifestyle, which is how the way you interact with the food, so your diet, the way you take care of your body, so your exercise and sleep, for example. So lifestyle, it's the very actionable factor that you can work on, and that's every patient's duty and responsibility to take care of. In the second bucket, I would say probably the single thing with the most evidence, which is vaccination. So prevent the diseases before they arise and help your body fighting them through up-to-date vaccination. And in the third bucket, that's a tricky one. I would probably say know yourself, know your health, and know your health with your doctor. So be informed about the effect of the medication that you're taking, the effect of the disease state that might go beyond the specific indication for which, for example, the medication are given. Discuss with your practitioner if you see something that is not right. So I would say develop and explore the knowledge of your body, and also the knowledge of your physician taking care of that. So these, I think, in my opinion, are the 3 most important factors.
That's great. Thank you so much, Fulvio. Thank you for
Deepa.
And we
it was a pleasure.
Back again, okay?
Yeah, I'm always here. Take care.
Take care.
Bye, everyone.